You're starting us off today.
Well, thank you very much, Sydney, and good afternoon, everyone. As we navigate through these turbulent waters, and as we have navigated through these turbulent waters over the last 13 plus months now, one of the things that has really struck me is how flexible and nimble people are in trying to come up with solutions to the challenges that we face. And when I say everyone, I'm talking about our residents, our citizens, people in healthcare, and certainly people who are working in government as well, who are trying to sometimes on very, very short notice, make changes to allow us to continue to do the very important work that we are doing, whether it's testing, whether it's vaccination, whether it's tracing, whether it's working with different organizations to make sure that we are addressing the safety protocol that are necessary. And another example of that is occurring today, because just yesterday we stood up our new community vaccination sites at the Northwest Health Center at 76th and Mill Road, and on the south side at the health center, the Southside Health Center at 23rd and Lapham. Both are running smoothly. And as some of you may know, these sites are replacing the previous sites we had at North Division and South Division High School. So the natural question is, of course, why are we changing? And the answer to that question is because both North Division and South Division High Schools will be having students. And so during a period before the Milwaukee Public Schools was returning for in-class instruction, working very closely with the superintendent and others in the school district, they were kind enough to allow us to use those locations, and they were very, very effective. Both North Division and South Division High Schools were very successful. And again, I want to thank Superintendent Posley, the school board, everyone at Milwaukee Public Schools that allowed us to do it. But now, as we all know, the kids are coming back to the schools for in-person teaching. And so it was important for us to continue this vaccination work because it is so important, to continue to have it in the neighborhoods because our goal is to have it close to where people can access it, and to have it done in a very efficient way. So again, we're proud that we've been able to set up these sites at the Northwest Health Center at 76th and Mill Road, as well as the Southside Health Center at 23rd and Lapham. The hours for these locations are Monday, Wednesday, and Friday from 10 a.m. to 4 p.m., and some additional later hours on Tuesday and Thursday from noon to 6 p.m. No appointments are necessary. So then the next natural question is, why the different hours? Well, I think the answer to that is probably pretty obvious as well. Different people have different work schedules. So we wanted to be able to have some people who come in the morning, some in the afternoon, and some after 5 o'clock. So that's why we have different hours. But again, it's 10 a.m. to 4 p.m. on Monday, Wednesdays, and Fridays, noon to 6 on Tuesdays and Thursdays. And again, as I said, no appointments are necessary. And that goes to the point that I'm sure the Commissioner Johnson will make and Dr. Weston will make. We have more than an adequate supply of vaccination. So we continue to want to urge people to come in and get vaccinations. Of course, vaccinations are continuing at the Wisconsin Center, also for walk-ins, 7 days a week. And this is as a result of the very strong partnership that we have had with our federal government, with FEMA, with the state of Wisconsin. And that is very, very important. But again, to put an exclamation point on this, we have a robust supply of vaccine available for Milwaukee residents to receive quickly, easily, and at no cost. So people who were eager to get the COVID-19 vaccine have probably already received their shots. I know there are lots of people who are thinking about it, and I want people to make a good fact-based decision. And I want that fact-based decision to be, yes, I should get the shot. So please get good information. You can start it at healthymke.com, the website. It's an important decision for yourself and your family. And I'm sure both Dr. Weston and Commissioner Johnson will urge you to get the shot as well. The time to act is now. We want to keep seeing our vaccination rates go up. We want to see our vaccination rates go up. We want to see our disease rate go down, and they are tied to each other. Every shot counts in our fight to beat COVID-19. So to make sure we're getting as many vaccines out in the community as possible, we are continuing our vaccination outreach efforts in the community. And I am extremely grateful to our faith community and community groups for being really phenomenal partners in this work. And just to give you an example, last week we were able to vaccinate 1,100 people at our mobile clinic at UMOS on the south side on Chase. So I want to give a special shout out to UMOS for being such a strong partner and helping us get people from the south side. Many people of Hispanic origin were able to take advantage of that, and I couldn't be happier about that. On the north side, this weekend, Bishop Darrell Hines from Christian Faith Church and Walgreens hosted a successful mobile clinic at Destiny Youth Plaza. So I want to thank Bishop Hines for his partnership. Today, from 12:30 to 4:30 p.m., Pastor John McVicker at Christ the King Baptist Church, located at 7750 North 60th Street, will be accepting walk-ins from the public. And next Tuesday, April 27th, from 9 a.m. to noon, Pastor Fred Thomas Brightfield from Jackson Park Lutheran Church, back on the south side at 4535 West Oklahoma, will be accepting walk-ins. And to show that we're trying to get it all over the city, next Tuesday also, from 1 to 4, Pastor Roy Hopgood Jr. from Mount Horeb Missionary Baptist Church, located at 5350 West Center Street in the Sherman Park area, will be accepting walk-ins. And finally, the one we're announcing today is next Thursday, April 29th, from noon to 4 p.m., Pastor Mary Martha Canas from Hephatha Lutheran Church, located at 1720 West Locust Street, will be accepting walk-ins as well. So I think you can see we are trying to bring the shots to the people. We know how important it is that people feel comfortable. We know how important it is for people to feel that they can do it in a setting that they feel secure in. So whether you go to the Wisconsin Center, whether you go to our sites, whether you go to some of these church locations or community locations, whether you go to some of the pharmacies, or whether you go to your own personal health care provider, we simply urge you to do everything you can to get the shot so we can drive down the numbers. So that's where we get the testing. And a reminder, in addition to vaccinations, testing is also available at the Northwest and Southside Health Centers Monday through Saturday from 9 a.m. to 2 p.m., in addition to testing at American Family Field. And again, big shout out to the Brewers, who not only are playing good baseball right now, but they're great community partners as well. And I'm thankful for that. As we see cases increase, which is not what I like to say, and seeing testing numbers remain low, which I also don't like to say, I cannot stress enough the importance of testing and tracking COVID-19 spread in our community. If you're feeling unwell, think you may have been exposed to someone who has tested positive, or even if you have been traveling and visiting with people outside of the state, please take advantage of free testing at our community sites. It's important, it's good for you, it's good for your family, and it's good for our community. And with that, I will turn it over to Dr. Weston. Dr. Weston.
Thank you, Mr. Mayor. Good afternoon. First, to our numbers, we are currently seeing an average of 141 new cases a day and about 1 death each day. In our disease burden trends, we continue to have a slow but steady rise in cases, though a stable percent positivity over the last few days. Now, of note, there was a 33% increase in COVID patients hospitalized over the weekend. So that will be a close number to watch, especially as we have seen increased hospitalizations in our neighboring states. We're seeing in Wisconsin and locally in Milwaukee County a slowing in individuals seeking out vaccines on a daily basis. Currently in the county, about 38% of people have received at least 1 dose of vaccine. Now, while that's on par with the 40% of the state that's received 1 dose, and the 40% of the country that's received 1 dose, that slowing means that we must work to shift our strategy for vaccination. So over the last few months, we've had great success in focusing much effort on opening large-scale vaccination sites. Individuals coming to the sites often were both eager for vaccination and able to frequently register online, travel for a vaccine, and find time to come in to receive the vaccine at a clinic. Now, as those willing and able populations become smaller and smaller, we're looking to shift focus. We see this shift particularly with health departments, including the Milwaukee Health Department. They're doing more walk-in clinics. They're doing more mobile vaccination sites. These are two great examples of ways to pull down and remove barriers to vaccination. And adding to these efforts, we in Milwaukee County are opening our Milwaukee County Office of Emergency Management vaccination site at Kosciuszko Community Center to allow for walk-ins as well. So starting today, you can walk in for the vaccine at Kosciuszko Community Center. That's at 2201 South 7th Street between 9 a.m. and 2 p.m. Monday through Friday. There's no appointment needed. As with every site, the vaccine is free, and we're offering Moderna at our site. And the clinic's open to anyone age 18 and older. So that's 9 a.m. to 2 p.m. walk-ins Monday through Friday. As we work to break down barriers to vaccine in the county, part of that is certainly having an effective and safe single-dose vaccine to make it easier to vaccinate hard-to-reach populations. And that vaccine, of course, is Johnson & Johnson. Now, the ACIP, that's the group that makes vaccine recommendations to the CDC and the FDA. They'll meet on Friday to discuss the vaccine and the next steps for usage. What we've learned since last week is that the instances of these blood clots continue to be extremely rare, about 1 case in every 1 million people vaccinated. Now, that's far, far less than the rate of blood clots with birth control, for example. Certainly less than the rate of blood clots with smoking, or for that matter, far less than the rate of blood clots when you're actually infected with COVID. People who are infected with COVID are many, many more times likely to get blood clots than those who receive the vaccine, the Johnson & Johnson vaccine, even these rare types of blood clots. Now, what's different about these few blood clots that were found in those who received Johnson & Johnson was that not only did they have this rare blood clot, but they also had a lower level of platelets. Platelets are the building blocks that in blood that help to build clots. So this is a less common combination and requires special treatment, more than just the standard blood thinners that are given for most patients with blood clots. So as the ACIP reviews the data and doctors become educated on how to recognize and treat these special types of blood clots, we can hopefully sooner than later see the return of this vaccine that will certainly play a critical role in the effective, efficient, and safe process of vaccinating our population. In the meantime, please visit one of our many vaccination sites, now many of which are walk-up. You can find all the sites, the details of each site at healthymke.com. Thank you very much. Stay safe, and I'll hand it to Commissioner Johnson.
Good afternoon. I want to echo the mayor and Dr. Weston on the importance of vaccinations. In the city of Milwaukee, 38.3% of eligible adults have received their first dose, and 20.7% have completed their vaccine series. We still have a long way to go, so we're continuing to encourage Milwaukeeans to get vaccinated. And we're also, at the Milwaukee Health Department, providing as many opportunities as we can to receive the vaccine. We have administered nearly 81,000 doses of vaccine at the Wisconsin Center and are still accepting walk-ins for anyone over the age of 16 who lives, works, or studies in Wisconsin. The FEMA Mass Vaccination Clinic has thousands of vaccines available daily. You can receive your vaccine without an appointment Monday through Saturday from 9 a.m. to 6 p.m. and Sundays from 9 a.m. to 4 p.m. In addition, the Milwaukee Health Department has partnered with businesses and faith-based communities throughout the city on mobile clinics. These pop-up clinics are walk-in only and bring vaccine to Milwaukee residents where they are. We have vaccinated almost 15,000 people through our mobile sites. The intention for our mobile sites is to create low barrier, easy access opportunities in Milwaukee to receive vaccine. This Saturday from 9 a.m. to 1 p.m., the Wisconsin Black Historical Society at 2620 West Center Street will be hosting a mobile vaccination site in partnership with Northwestern Mutual and the Metcalf neighborhood. Even as we're seeing an increase in our vaccination rates, we still need to stay diligent about safety practices going forward. The 7-day positivity rate in the city of Milwaukee is currently at 6.1%, placing us in the moderate transmission category. So we're not out of the woods. I want to reiterate that we all must continue to wear our masks when we are in public, wash our hands diligently, avoid large gatherings, and maintain 6 feet of distance whenever possible. If you've come in contact with someone who has tested positive, please quarantine and get tested if you experience any symptoms. We cannot yet relax our safety precautions. Finally, this week is National Lab Week, which recognizes clinical and public health lab professionals for their contributions they've made to our health and our community, and support to the Milwaukee Health Department's lab professionals. They are an incredible asset to our city and have been working tirelessly to process a high volume of COVID-19 tests over the past year, in addition to continuing their work on non-COVID related activities. Please thank a lab professional this week. Thank you.
Thank you, Commissioner Johnson. Our first question comes from Joyce Garbasiak at WISN for Dr. Weston. Even if the ACIP recommends the pause on the Johnson & Johnson vaccine be lifted, be lifted, what more can be done to overcome the stigma now associated with it?
So I think this is a discussion of understanding the risk profile of a vaccine, or really any medication for that matter. We'll talk a lot more about this in the coming media briefings and other discussions. But as more data comes out, it certainly is looking like there's about a 1 in a million chance of getting this type of blood clot when you take the Johnson & Johnson vaccine. Every single medication we take has some risks. This is actually an extremely low level of risk compared to every other medication probably in your medicine cabinet, whether it's over the counter or prescription. They all have risks. So understanding that risk profile, understanding the benefits that come with the vaccine are going to be important discussions to have.
Thank you, Dr. Weston. Our next question is from Ben Wagner for the whole panel. Looking at vaccine data in Milwaukee County, there are clear differences in the number of people getting vaccinated neighborhood by neighborhood. Suburbs have high rates while some bordering Milwaukee neighborhoods do not. What worries you most when you see such a difference in a similar geographic area? What does this mean for those who are vaccinated? Can we reach herd immunity with such stark differences in vaccine rates?
Well, I can tell you what concerns me, and that is making sure that we have it available to as many people as possible. And earlier in my comments, I talked about the very, very extensive proactive outreach that we're doing in the city to make sure that we are getting to neighborhoods where people historically have had healthcare disadvantages, where there have been racial injustices, and making sure both on the north side and the south side, this is available to everyone. So whether it's at the Wisconsin Center, which is open to everyone, whether it's the Northwest Health Side Center, the Southside Health Center, or the very, very large and growing number of community and faith partners, we are trying to make sure that everyone has an opportunity to get the vaccination. But actually what concerns me as much as anything is the reports that I'm seeing that there is literally a political divide between those who are eager or willing to get the vaccination and those who are not. And when you talk about herd immunity, it's reaching a relatively high threshold of people in our society overall. And if we unfortunately see a political divide, we know right off the bat that there's going to be 40% of the people who won't go then, and that's what makes it more difficult for us as well. So yes, I am concerned about the equity issues. I continue to remain concerned about the political issues. And I realize that there's distrust. I think we all realize that there's distrust of government for either past sins or misperceptions or just downright distrust. But every expert that I have heard and every healthcare expert I have heard has stressed how the benefits of this far outweigh the costs, if you will. And even with the Johnson & Johnson vaccination, the CDC is making that same statement, or the FDA is making that same statement, that the benefits so overwhelmingly outweigh the very, very minuscule concerns that we should continue to go forward with that. So I don't know if Dr. Weston or the Commissioner Johnson feels that way, but from my standpoint as the non-medical person on the call, I want to make sure that we have an equitable distribution. I think we are achieving that, and I want everyone to have access to this.
Thank you, Mayor Barrett. Our next question from Joyce Garbasiak at WISN for the Mayor and Commissioner Johnson. As you work on making vaccines more available, are there any plans for a drive-through vaccination option in Milwaukee and the county? For example, State Fair Park.
Yes, we are working on a drive-through option and maybe more than one in the month of May.
And I just want to point out, we are doing drive up for people with mobility issues at both community vaccination sites as well.
Our next question is from Madeline Anderson at Fox 6. Are we still seeing a racial gap in who is seeking out the vaccine? And if so, what is being done to close that gap?
So we still are seeing inequities in the number of vaccines that have been given in different populations. We are working at the Milwaukee Health Department. We are training a group of individuals. We're calling them our Crush COVID crew. And I know similarly, there's a process or a group working on it at the county as well. And there are numerous other organizations in the city of Milwaukee who received grant dollars to mobilize individuals who are really ambassadors, messengers, formal and informal leaders in the county and in the city to have sort of those one-on-one conversations with people who may be less comfortable being vaccinated and trying to address their concerns so that they do feel comfortable being vaccinated. So there is a concerted effort at many levels in both the city and county to address it.
Yeah, I agree completely with what Commissioner Johnson said. And I would just modify the premise of the question a bit. I think that we're certainly seeing a decreased number of vaccine doses being administered to people in vulnerable groups, whether that's race and ethnicity vulnerability, whether that's economic vulnerability. But when we look at the surveys, the national surveys and more local surveys that are going on, the hesitancy is not necessarily coming along race and ethnicity lines. There are other barriers that are in place. There's transportation barriers, there's childcare barriers, there's work barriers. If you work 3 different jobs, it might be hard to make your way to a vaccination site. And so I think that's why it's so critical to pull down those barriers and to educate. And that's what the Milwaukee Health Department's been doing. That's what Milwaukee County's been doing. That's what the other health departments in Milwaukee County have been working to do, as well as health systems, is to pull down those barriers more and more and reach not only the easy to reach groups, but start reaching the harder to reach groups who still are interested in the vaccine, would like to get the vaccine, or would like to learn more about the vaccine. And looking at the surveys out there, we know there's lots and lots of people who fall into those groups.
Thank you, Dr. Weston. Our next question is from Sari Lesk at the Milwaukee Business Journal. These first 2 questions from Sari look to be for Commissioner Johnson. Last week's COVID-19 update from the city of Milwaukee said the disease burden is now in the high transmission category. Why is the city staying in phase 6 of its restrictions, and do you still intend to stay in that category for at least 3 more weeks?
We are currently planning to stay in phase 6. We still do have 2 of our key indicators. One is in phase 6 and one is in phase 5. So we're straddling the 2. As Dr. Weston mentioned, we have seen an increased number of cases, but it's a slow, steady increase. I'm really hopeful that that's going to turn around. And we're trying to really incentivize and encourage people to be vaccinated. So we have lots of tools in our toolbox right now. Vaccination is our most powerful tool in the moment. And we really want to encourage people to be vaccinated and incentivize that in any way we can.
The next question from Sari Lesk is the city's gating criteria call for an 80% adult vaccination rate to reach phase 7. Considering vaccine hesitancy, when do you anticipate the city will reach that mark? And how much weight will the vaccination rate carry in the decision if the other gating criteria are in phase 7 territory?
So we put 80% in the phase 7 as a goal and not necessarily as a metric or benchmark that we'd be measuring against when we get there. It just is, we wanted to put that out there, recognizing that herd immunity is in practical terms is how we know when people will no longer be spreading the disease, but also knowing that there may be situations where we're not going to get to 80%. And certainly since children are not yet eligible for vaccine. So we put that in there just sort of as a placeholder, but it's never been intended to be the threshold that we have to meet to move into phase 7.
And one more question from Sari Lesk for anyone on the panel. Understanding the focus is on the vaccination effort, looking down the road to booster shots, how might this setup look? Do you envision all these community partners will make their spaces available for boosters when that time comes? Will some other more permanent and long-term system be devised that still makes the booster easily accessible?
I think it's hard to predict what the landscape will look like by the time that we're moving into booster shots. I think certainly at some point with COVID, much like other illnesses, much like the flu and things like that, hopefully we reach a level of vaccination where we can shift a lot of the resources, a lot of the vaccination efforts to more traditional means, whether that's health departments, but certainly in a large part to health systems as well. So I think we'll see a shift in vaccination efforts, but it's hard to predict at this early point what that booster shot infrastructure will look like.
Our next question is from Tom Durian at TMJ4 for Dr. Weston or Mayor Barrett. With the extra vaccines available, at what point should we be concerned with reaching herd immunity?
I think the goal right now is to continue vaccinating as many people as possible. And I think that we certainly have reached an end of one point, and that's the end of the point of the high eagerness among people who are able to travel and reach vaccine. People like myself, people like others on this briefing who would travel wherever they needed to go, take whatever time they needed, and were able to travel and able to take that time to get the vaccine. We don't see that high level of eagerness, but I don't think that means that we've reached the wall of vaccine hesitancy, or certainly the wall of people who absolutely won't get the vaccine. I think we have a long way to go. I think we need to continue to pull down barriers and continue to offer vaccine in an accessible, convenient way to people who don't yet have it.
Our next question is from Rose Schmidt at CBS 58. Do you attribute vaccine hesitancy as the reason the vaccine numbers are leveling off in the county? If so, how do you overcome this?
So I think the last answer kind of addresses that as well, but I don't think that, again, we've reached a wall of hesitancy. I think we've reached the end of kind of extreme eagerness among those who are able and willing to travel and take time to get the vaccine. But I think we have a long way to go. I think we have a large population that is still desiring the vaccine or looking to learn more about the vaccine.
Our next question comes from Me Wisconsin News. Pfizer announced a few weeks ago the possibility of a third vaccine. What preliminary information is available about the possible third dose? Are we already talking about a plan to buy the third vaccine or get the third vaccine for Milwaukee residents?
So just to be clear here, what Pfizer had talked about is the potential that there may need to be a booster at some point. And that's typical of pretty much every vaccine that we have for anything, whether it's tetanus, whether it's flu, whatever it is. So we've seen great data coming out about, in particular, the Moderna and Pfizer vaccines. Initially, 3 months in, we said the vaccine works for 3 months. Now we've had people who've had it for 6 months, and they have outstanding protection 6 months in. I think that time will continue to grow. But at some point, a vaccine doesn't last forever. The immunity that it provides doesn't last forever. And so a booster is needed. And that booster may modify a bit to get new variants included. But that's what Pfizer was talking about. Moderna has been talking about is eventually probably a booster will be needed.
Our next question is for Mayor Barrett from Rose Schmidt at CBS 58. Mayor Barrett, is the city taking any steps to prepare for the impending jury verdict in the Derek Chauvin trial, especially in terms of security and safety?
Well, I can tell you that the Milwaukee Police Department has been working in conjunction with the Milwaukee Fire Department, as well as the Milwaukee County Sheriff's Office, to ensure that if there are demonstrations, they will be peaceful. They've had a number of meetings. I've been included in a number of those meetings and briefings to let me know exactly what they are preparing to do. So hopefully whatever occurs will be peaceful, but they certainly are preparing for different scenarios.
Our next question is from Mayan Silver at WUWM for Dr. Weston. Are there plans in Milwaukee to reach out to people who already got the Johnson & Johnson vaccine here to monitor them for potential clotting issues? And do you anticipate this would be a part of an unpausing of the Johnson & Johnson vaccine?
Yeah, so the Wisconsin DHS did recommend that people who have been administered Johnson & Johnson are contacted. We did that through the Milwaukee County site. Other health departments and health systems have done the same, just to make them aware of the very rare issues that occurred potentially related to the Johnson & Johnson vaccine. As for disease monitoring, the CDC has a robust system where they monitor people who've received the vaccine for any sort of side effects.
Thank you. Our next question is from Joyce Garbasiak at WISN for Commissioner Johnson. Can you elaborate on where the drive-through option in May would be?
So we're still working on the final logistics. I don't want to make an announcement until we have it finalized.
Thank you. Our next question is from Madeline Anderson for Mayor Barrett. You mentioned there's a political divide in who is getting the vaccine. Can you elaborate on what the city or county is seeing?
Well, I can tell you that was presented to me in a slideshow form. I think it might have been Mara Lord from the medical college in the outreach group that showed that, for me, a surprisingly high number of Republicans were not interested in getting the vaccination. So I have not done an analysis either in the city or the county, but that may have been national information. But again, I don't see any reason to have a political divide here, and I hope that there isn't a political divide here locally.
Next question is from Sari Lusk at the Milwaukee Business Journal. Regarding hesitancy, how much impact do you think side effects play? Perhaps being able perhaps people being open to getting vaccinated, but unable to risk having to take a day off work if they have severe fatigue or fever or any of those other tougher responses some people have reported.
I think certainly that is a role. I've in hesitancy, I've heard that from people that they're nervous they're going to get the mild flu-like symptoms that can last up to 24 hours after getting the vaccine, and potentially miss a day of work, which I can certainly understand the concern there. Most people don't get that. Most people have a bit of a sore arm or nothing, and that's it. So certainly talk to your friends, talk to your neighbors, talk to your colleagues who have been vaccinated about what their experiences were. But I think, again, this is a risk-benefit discussion. Also talk to your friends, talk to your colleagues, talk to your family members who had COVID and ask them what their experiences were, how many days of work they missed, what sort of symptoms they still have lingering. And then you have to weigh those two and decide which is the greater risk, which is the greater benefit.
Just catching up. Next question is from Drake Bentley at the Milwaukee Journal-Sentinel for Dr. Weston. In your opinion, what's the probability that Johnson & Johnson will return?
Oh, I think there's a very high probability that Johnson & Johnson will return. It's been proven to be an extremely effective vaccine off of a single dose as opposed to 2 doses from the other vaccines. And it's also been shown to be incredibly safe. It was tested on tens of thousands of people, just like the other 2 vaccines. But when you give it to millions and millions of people, you start to notice these extremely rare adverse events that can potentially occur. So I think the Johnson & Johnson vaccine has an extremely high probability of coming back, perhaps with some added warnings or some limitations in very specific populations that may be at slightly higher risk.
Next question is from Sari Lusk at the Milwaukee Business Journal for Commissioner Johnson. Could you provide a little more color on how you view and use the gating criteria you released? If the metrics are only placeholders, what role do these gating criteria play in deciding how the health department will respond to shifts in transmission?
Sure. So I should have been more clear. The gating criteria that we've put forward, the rate of COVID-19 per 100,000 over 7 days, and the percent positivity over 7 days are not placeholders. So we're sticking to those metrics. I was strictly speaking to the vaccination rate number. And if you look at our gating criteria on our website, you can see that under vaccination rates, it says not applicable under every single transmission other than low. And again, I think we put that in there as an indicator of where we would ideally be to reach herd immunity in the city of Milwaukee would be 80%, but also recognizing that there are limitations to us getting to that 80% before we would potentially be in the low transmission.
That appears to be the final COVID-related question. Are there any other questions, COVID-related questions from the media at this point?
If I may, I just want to add one thing. I was informed that the number of Republicans nationally who definitely say they will not get the vaccination is 29%. I think I used the word 40%, so I don't know